you're a brand new baby, you're born with a pump, your heart, and it works beautifully. In most babies, not all babies, I know, but in most babies it works perfectly. It has valves, it has veins that go to it, it has arteries that go to it and away from it. It has 4 chambers. The doors on the chambers referred to as valves. The outflow doors are called valves. And that's how it works. It's a very, very simple pump system. But as you get older, remember, the heart doesn't just exist in and of itself like in a vacuum. It's just like a highway. It's like, well, I'm driving up Route 75 today, and there's the rotary up ahead. Always go around that rotary. Well, I'm always going to drive up Route 75, and I'm going to drive up it every day at 4 o'clock. Every day I drive up Route 75 at 4 o'clock, the same stretch. The traffic is different. Well, why is the traffic different? I don't know. Because they had a convention at the major convention center up ahead, or they're down to 3 lanes because they're doing road work, or there's 2 ramps that are blocked because there's been a motor vehicle accident, you know, blah, 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 blah. So the tributaries that come off the highway, also known as the arteries and the veins, can affect the main flow of Route 75, also the heart. So remember, the heart's just like that highway. It in and of itself has places that it sends blood to, major arteries and veins, and then those feed into minor arteries and veins. The further you get away from the heart, into the arms and the legs, the smaller the highway gets, the back roads. By the time you get to your toe, you're past the suburbs and now you're rural. And so you can imagine how much it doesn't take for fat and deposits of atherosclerosis to occur way in the country of the toe. And then there's lack of blood flow there. So we talk about blood flow macrovascular, meaning the larger blood flow, the coronary arteries, the carotid arteries in the neck, the aorta that comes off the heart, the major supplier of blood to the lower part of the body and the upper part of the legs. And then the further away you get, we call that microvascular, because then the blood vessels get smaller and smaller and smaller. Distally, we call it, or peripherally. That also includes the blood vessels that go to the brain, because once you get into the blood flow of the brain, the blood vessels get very, very small. So you'll hear us talking about peripheral vascular disease or peripheral artery disease. And those are all the little tributaries that come off the heart and off all the major arteries and veins and go to the smaller and more distal places in the human body. And all you have to do is start picking off some of those. Some of the deep, smallest arterioles in the brain can all of a sudden explode because the blood pressure is too high. And then that's called a lacunar infarct. What that means, lacune in Latin means lake. Bleeds like a little bit of a lake. You're not going to be able to have a drooping face or a slouch on the side of your body with paralysis. It might just mean that you don't know where your car keys are anymore, or what your dog's name that died used to be. It's all of a sudden forgetfulness that can happen. So you have to keep an eye on the macrovasculature, the large blood vessels, and the microvasculature, the smaller blood vessels, because all are susceptible to disease. And they all are supplied from the muscle, the heart, at the very, very heart of the circulation, which is where all starts from, which is why that pump function needs to be preserved in the first place.